Do you know the early warning signs of colon cancer? It's a question that merits serious attention, given the prevalence and impact of this disease globally. In the year 2020, cancer claimed around 10 million lives worldwide, and a significant portion of these deaths were due to colon cancer. In the United States alone, about 150,000 Americans are diagnosed with colorectal cancer every year. To put things more into perspective, more than 50,000 people will die from colorectal cancer this year. 1 in 24 people will be diagnosed with colorectal cancer in their lifetime. The average age of diagnosis among men and women is usually 66, although recently this age is going down with more people diagnosed at a younger age. In this video, we will discuss 8 early warning signs of colon cancer that you must not ignore. We will also discuss prevention methods through changes in diet and lifestyle. But before we delve into all that, let's make sure we're all on the same page about what the colon is and why its health matters. The colon, or large intestine, is a vital part of our digestive system. It's the final stop for food after it has been broken down in the stomach and absorbed in the small intestine. The colon's role is to absorb water and salt from the remaining food matter and to store waste before it's expelled from the body. Interestingly, colon cancer often begins as small, benign clumps of cells called polyps. Over time, some of these polyps can grow into colon cancers. This is why regular screening to detect and remove polyps early is so crucial in preventing colon cancer. We will discuss this in detail later in the video. So, how can we tell if something is wrong in our colon? This brings us to the crux of our discussion today: the early warning signs of colon cancer. These signs are so important to recognize, as early detection significantly increases the chances of successful treatment and survival. Each of the 8 signs we'll mention is a crucial piece of the puzzle, with number 1, which we will mention at the very end, being the most critical of them all. But before we dive in, please do us a favor. If you're interested in health and longevity, give this video a thumbs up. If you're new here, subscribe to our channel. We bring you scientifically researched health content daily. You have nothing to lose, just a wealth of knowledge to gain. Starting off at number 8, we have nausea. Now, occasional bouts of nausea are usually nothing to worry about. However, if you notice that you're frequently feeling nauseous or sick to your stomach, it may be a cause for concern. Nausea can be a symptom of colon cancer because the tumor in the colon can disrupt the normal digestive process, causing discomfort and feelings of sickness. A study conducted by the American Cancer Society found that persistent nausea, especially when paired with other symptoms like weight loss and fatigue, can be an early warning sign of colon cancer. It's important to remember that nausea can be linked to many conditions and not just colon cancer. But if it persists, especially if you notice any other changes like weight loss or fatigue, it might be time to consult your doctor. Moving on to the next warning sign at number 7, unexpected weight loss. Now, most of us wouldn't mind shedding a few pounds here and there, but when it comes to cancer, unexplained weight loss could be a cause for concern. This is because cancer cells use up a substantial amount of the body's energy supply, which can result in weight loss. In fact, according to a study published by the American Cancer Society, unexplained weight loss of 10 pounds or more could be one of the first noticeable signs of cancer. Next up, at number 6, recurring abdominal pain. Now, experiencing abdominal pain from time to time is completely normal. However, consistent and severe abdominal pain could be a sign of colon cancer. This is because tumors in the colon can cause blockages, leading to discomfort and pain. A study published by the National Cancer Institute found that persistent abdominal pain was a common symptom among colon cancer patients. Number 5, anemia. Anemia is a condition characterized by a lack of healthy red blood cells in the body. This can result in fatigue, weakness, and shortness of breath. Colon cancer can cause anemia by causing bleeding in the colon, which can lead to a decrease in red blood cells. A study published in the Journal of Clinical Oncology found that anemia was a common symptom among colon cancer patients and was associated with a poorer prognosis. A simple CBC, complete blood count, can show if you have anemia. Liking our video so far? Before we move on to the next sign, don't forget to hit the like button and subscribe to our channel so you never miss out on our new informative videos. Number 4, ineffective bowel movements. This refers to the feeling that you haven't completely emptied your bowels even after you've gone to the bathroom. This can be caused by a tumor in the colon blocking the passage of stool. According to a study published in the Journal of Gastroenterology and Hepatology, Ineffective bowel movements were a common symptom among colon cancer patients. Number 3. Changes in bowel habits, including constipation and diarrhea. If you're experiencing consistent changes in the consistency of your stool, it could be a sign of colon cancer. This happens when a tumor in the colon disrupts the normal digestive process. A study published in the Journal of the American Medical Association found that changes in bowel habits were a significant predictor of colon cancer. Number 2. Narrow stools. This is because a tumor in the colon can narrow the passage through which stool passes, resulting in narrow or thin stools. According to a study published in the American Journal of Gastroenterology, narrow stools were a common symptom among colon cancer patients. These signs should not be ignored, especially if they persist. Remember, early detection is key in the fight against colon cancer. If you're experiencing any of these symptoms, it's important to consult with a healthcare professional right away. And now, the most alarming sign? Number 1. Rectal bleeding. It's a clear signal that something's not right in your digestive tract. When blood vessels in the rectum or colon get damaged, that's when rectal bleeding occurs. It can manifest as bright red blood in your stool, on toilet paper, or in the toilet bowl. Now, here's where it gets tricky. Hemorrhoids, which are swollen blood vessels in the rectum or anus, can also cause rectal bleeding. But don't let this fact lull you into a false sense of security. A study published in the British Journal of Surgery found that nearly 3 out of 10 patients who initially attributed their rectal bleeding to hemorrhoids were later diagnosed with colon cancer. This is why it's critical to get any rectal bleeding checked out by a healthcare professional. Remember, rectal bleeding can also be a sign of hemorrhoids, but it must be investigated, especially if the stool appears black and tarry in color. Dark black stool or melena can be a sign of colon cancer due to bleeding within the colon. As the blood is digested while passing through the gastrointestinal tract, it can turn the stool a dark tarry color. This bleeding may occur from ulceration or growth of tumors in the colon, while other conditions like peptic ulcers or certain medications can also cause black stools. Persistent changes in stool color, especially with symptoms like abdominal pain or weight loss, should be evaluated by a healthcare professional. Stool examinations can sometimes be requested in order to better evaluate a case. For example, an occult blood stool test is a screening method used to detect hidden, occult, blood in the stool, which can be an early sign of colon cancer or other gastrointestinal issues. Now that we know the signs to look out for, let's talk prevention. The best defense is a good defense, right? A balanced diet is the cornerstone of prevention. Load up on vegetables such as greens, tomatoes, onions, broccoli, eggplant, and carrots. They're all good for you. Add fruits to your daily diet too. Think berries, melons, apples, pears, oranges, and bananas. These are rich in antioxidants and fibers, which can help fight off cancer cells and keep your colon healthy. Fiber in particular is vital for colon health and for colon cancer prevention. Whole grains and beans are also key players. Quinoa, oats, black rice, wild rice, lentils, beans, and legumes. They're all packed with fiber that helps in maintaining a healthy digestive system. On the other hand, it's best to limit your intake of red meat and processed meats. Research has shown that these can increase your risk of colon cancer due to the presence of harmful substances such as heterocyclic amines, HCAs, and polycyclic aromatic hydrocarbons, PAHs, formed during high-temperature cooking, as well as nitrates and nitrites used in processing. These substances can damage the cells lining the colon, leading to mutations and the development of cancer. Calcium and vitamin D are also essential in your diet. They work together to help your body absorb calcium, which is believed to help prevent cancerous growths in the colon. You can get these nutrients from dairy products, fortified foods, and sunlight for vitamin D. You can also get them from supplements. A healthy lifestyle goes beyond just diet. Quitting smoking and limiting alcohol consumption can significantly lower your risk for colon cancer as well as many other cancers. Regular exercise is also key. It not only keeps your body fit but also helps in maintaining a healthy digestive system. Research has shown that people who exercise regularly have a lower risk of developing colon cancer. Fasting and a ketogenic diet may also be beneficial. Studies suggest that these methods can help in reducing inflammation and promoting cell repair, both of which can help in preventing colon cancer. Of course, regular screenings are also crucial. A colonoscopy can help in detecting and removing polyps before they turn cancerous. A colonoscopy is a medical procedure where a doctor uses a long, flexible tube with a camera to examine the inside of the colon and rectum. This procedure helps detect abnormalities like polyps, tumors, inflammation, and ulcers, and can also be used to remove polyps for further examination to prevent colon cancer. Let us know in the comments below if you've had a colonoscopy before. Please share your experiences with us. Colonoscopies are especially important if you're over 50 or have a family history of the disease. Keep in mind, prevention is not about living in fear. It's about being proactive and ensuring that you're doing everything you can to stay healthy. Remember, prevention is always better than cure. Let's recap what we've learned today. Colon cancer is a grave health concern, claiming thousands of lives every year. However, early detection can be a game changer, significantly improving survival rates. We've explored 8 early warning signs of colon cancer. We also dived into prevention methods. In conclusion, being aware of these early signs and prevention methods can save your life. Remember, the colon is a vital part of our body, and its health directly impacts our well-being. Enjoyed the video? Hit the like button and subscribe to our channel for more informative videos like this one. We provide research-backed health content every day. While you're here, check out our other videos as well. Until next time, stay healthy.